Welcome, dear viewers, to our series Natural Medicine. I recently had the great pleasure of having a discussion with a cancer researcher and was given such amazing information that I have to coordinate my whole consciousness about cancer from scratch. And I want to go into this topic again today, because I have a professor here today who has been bringing this topic out into the world for over 30 years and trained already over 500 medical professionals in biological medicine. And he can tell me a lot more about this topic. So please, please, please stay tuned. Also, stay tuned so that you can spread this show at the end. Because cancer is a huge pandemic and it's not getting any smaller. It looks like cancer is going to be on the rise and we should all be taking some kind of precaution, as long as the horse has not bolted yet, so please stay tuned. And I'd like to introduce you to my guest, Professor Dr. Thomas Rouse. Welcome, dear Thomas. Cancer is a horrible story. I believe that just making a diagnosis is already dangerous. Making a diagnosis to a patient, if you know from psychosomatic medicine or from psychoneuroimmunology that the diagnosis already has a prophesying effect. Cancer is always associated with death. And yet there are an incredible number of chances and possibilities to heal a cancer patient. And that's why I'd like to ask you. You know who I was talking about before, Lothar Hernese? Please, I'd like to give you the floor on the subject of cancer. Nice. Thank you very much for asking me about my topic. But you know I'm a practitioner, practicing physician for 40 years. Professor or not, doesn't matter. It sounds so scientific. But what I really do is treat people. Cancer patients, half of my patients, even a bit more, are cancer patients. They may already have conventional treatment. They're in stage 4. They're in stage 1 to 2, freshly discovered. I answer the phone. Oh, my sister has breast cancer. Can you do something? Yes, of course, I can do something, even a lot. No cancer therapy without biological concomitant therapy. I can say this with great certainty today. And I really have a lot of experience. I'm not saying I cure cancer, but I can improve the course, and I'm sure of that. And sometimes massively. I could tell you individual cases. Every doctor can do that. Everyone can show off great individual cases. No, on average, my thousands of cancer patients, I've been doing this for about 25 years, intensive cancer therapy, with us in the Sonnenberg clinic in Schwelbrunn in Switzerland, we are now constantly integrating new therapies. I'm not saying conventional medical treatment is bad. You should do it or you shouldn't do it. No, you can do that, but never just conventional medical treatment. Biological cancer therapy is something very successful and absolutely logical. The cancer cell has a different metabolism than the healthy cell. Well, the tissue has a completely different metabolism than healthy tissue. This researcher said, I know him personally, I really appreciate him because he also does a lot of training. And he said the cancer cell absorbs a lot more toxins. Yes, even conventional medical oncology knows that. That's why you do chemotherapy, because the chemotherapy can then penetrate more into the cancerous tissue. It's just stupid that the healthy cells also suffer from it. Well, the next step would be you could detoxify the healthy cells that have a different metabolism, according to their metabolism and the other cancer cells. They could remain poisoned so that they die. Just a quick thought. That's the milieu thinking which somewhere in conventional medicine has not yet gained a foothold, but we are still focusing on the pathogen and not on the environment. Exactly. We see the evil cancer cell, we see the virus, we see the bacterium, and you have to use the strongest weapon against this terrorist. You have to fight it. Yeah, but why can a bacterium, why can a cancer cell, why can a virus get up in the dynamic system of human metabolism at all? Everything you say is so logical, because the system is no longer correct. In an ailing state, terrorists also appear. You also have to change a state, not just shoot the terrorists. I'm sorry, it's an acute political example. But I don't want to go into that now. No, I want to say we treat the different nature of the cancer cell metabolism. Cancer cells cannot use oxygen. They therefore need carbohydrates. So sugar. Cancer needs sugar. A catchphrase. If you want to weaken the cancer, then you must not give it sugar. As simple as that. But nobody tells you that. Recently, 3 or 4 months ago, I had someone here who had already survived their 10th chemotherapy and came to my practice with a croissant in their hand, to the health center at the time with a croissant. And they'd never heard that they shouldn't necessarily eat carbohydrates for breakfast. Never heard it. Yeah, terrible. What else can I say? Terrible. When an oncologist fails to explain and change their patient's diet very intensively, then they are pseudo-specialists because they do not represent all approaches. If they were specialists, they would know that. Excuse me, but let's continue. The cancer cell has, I come back to the sugar and the oxygen. The cancer cell can be specifically suppressed with oxygen or ozone. By removing the sugar from the metabolism, the cancer cells can specifically be reduced in their metabolism. You have to do that. There are therapies for that. It's also quite logical what you say when there is this cell, and I'm doing exactly what you said now, then it must actually become smaller or certainly not grow anymore. Exactly. I continue. The cancer cell has a different cell wall. The cell membranes are different. Their tension. They have a reduced surface tension of 20-30 millivolts. A healthy cell has a surface tension of 40 to 60 millivolts. A cell of a baby, 80 millivolts. So, this energetic drop in the cancer cell is important for the growth of the cancerous tissue. And if you can increase this membrane potential, now that's biophysics, if you can increase this membrane potential, there are techniques for that, then the cancer metabolism decreases. And a highly aggressive breast cancer, for example, can be transformed into a lower level of aggression with these 2 methods alone. Yeah, today it's measured. You have a Ki-67 index. Dear Mrs. So-and-so, your breast cancer is very, very malignant. That's true if you don't do anything, or just treat it with chemotherapy, or take that as an argument to do chemotherapy. But we can change this Ki-67 index. We can change the malignancy index. We can make this tissue a little less terroristic. Yeah, very easily. No, it's not easy, but there are targeted, logical therapies for it. Our biological cancer therapy is very logical. Third, the cancer cell is, sensitive to heat. A healthy cell, a healthy tissue, can withstand a temperature of 42 to 44 degrees Celsius. Not long, of course, but it survives that. If you now apply heat, the tissues do not break immediately, but the cancerous tissue does. Hence this hypothermia. All these hypothermic therapies, these heat therapies, whether you do it systematically in the whole person, or only locally, or whether you do it with local hypothermia, or also part of the mistletoe therapy is based on this. With the mistletoe, the overall temperature of the body is raised, even a little. This already promotes the activity of the white blood cells, the granulocytes, the killer cells, and reduces the activity of the cancer cell. So the immune system is strengthened, cancer is weakened, with the slight increase in temperature alone. We have local temperature methods in DIBA, Erytherm, the whole body hypothermia, and so on, where we can locally heat up the cancer, the tissue to 42 degrees Celsius. Cancer can't take it. Metastases are inactivated. This works so well with bone metastases, for example. We have techniques there. Biological cancer therapy uses equipment that is technologically sophisticated, very sophisticated, and we have integrated them here at the Sonnenberg Clinic in Schwelbrum. We also do whole body hypothermia. Well, the white blood cells, the phagocytes, the NK, natural killer cells, NK cells, are tested. We can stimulate this with hypothermia. And we also have drugs that specifically target the activity of granulocytes, scavenger cells, macrophages, but also these killer cells. It's a lymph cell division that we can stimulate. The body then begins to work harder against its cancerous tissue. Chemotherapy suppresses the killer cells, suppresses the phagocytes, but makes the immune system weaker too. I don't say destroys it, but makes it weaker. That's just not right when you're just doing chemotherapy, or chemotherapy and radiation. These are all anti-therapies. We do pro-therapy. That's the milieu again, isn't it? That is the milieu. I have an important question. Namely, I keep hearing if I have a tumour, it has to go immediately. There's panic, everyone's screaming, you have to operate in 2 weeks, otherwise there will be metastases and it gets into the blood. But on the other hand, you do a biopsy. And during the biopsy, I keep hearing, actually, millions of cancer cells get into the blood. And so I ask myself, doesn't it contradict itself? A biopsy and saying, I have to act fast, those are contradictions. I had a good friend early in my medical career. I did surgeries with him. We used to operate on breast cancer ourselves in our clinic, in what was then the clinic. And he was a real surgeon and said, you know, you must mow the grass when it's standing. And a lot of this sudden therapy. Now we have breast cancer. I had a patient like this 2 weeks ago. We discovered a lump. We have to do a biopsy immediately. Then did a biopsy, then it was breast cancer, but not that highly malignant, and we have to operate immediately. Now, the grass is high, don't wait for the storm to come, and do something else. No. No need. Newly discovered cancer is not an emergency. That's a situation where you talk to your doctor and a biologically experienced cancer therapist together, or apart if they can't get along, and develop a strategy. It's not an emergency. It doesn't need surgery tomorrow. On the contrary, you have to prepare well. I'm not against having the cancer operated on, removed, no. But you have to prepare well, prepare the system, prepare the environment, prepare the immune system. People's ability to heal, improve, so that after surgery, the region heals again. That's so important. And the question of biopsy is an extremely controversial issue. I don't know. I still have known Hacketal. He was well known. I was able to get to know this urology professor. And he said, no biopsy. Do not do biopsy on the prostate, because you can scatter cells with it. That was your question. I'm not exactly sure if that is true or not. Personally, I'm not for the biopsies. On the other hand, I'm of course happy when you know what kind of histology a cancer has. Yeah, prostate cancer no longer requires a biopsy. With blood work, with ultrasound, you can say with almost complete certainty whether it's cancer or not. Because of this, and with the prostate biopsy, there was this controversial topic that a biopsy can also scatter cells. What is known today is that, unfortunately, many prostate cancer bone metastases get created very early. So, if you have prostate cancer and you are a person prone to metastases, that is very individual, then these metastases are already dormant in the bone very early on, and then eventually come to expression if other, let's just say, milieu situations change. That's why it's dangerous to do a biopsy, as Hacketal said and documented at the time. He's not well known anymore because that was about 20 years ago. He has proven that in many cases and has seen that metastasis occurs very early. Something that also surprised me when I spoke to this cancer researcher is that, in simple non-medical pictures, a cell also needs sugar, and insulin takes the sugar out again and spreads it around the body. But a lot of people that really have been in stress mode for months, years, eventually produce less adrenaline just out of exhaustion. The sugar stays in the cell would actually suffocate. So the body actually has to make a survival mode and switch from oxygen to the fermentation process to burn the sugar. It's actually good that the body does that, otherwise the cell would die. And that gives me a completely different way of thinking about this cell. I have to say, actually it wasn't evil at all, it's the underlying causes that led to it. And now we come into a very sensible prevention. We have to awaken people's awareness to take care that they get out of their constant sympathetic nervous system and promote and challenge the parasympathetic nervous system. You know too much. Those are very good questions. But I don't know if the layman, who is also watching us here, will be able to follow along. I think I have to say 100% yes. This topic, sympathetic nervous system, has a very important influence on the development of the cancer patient. With us at the Sonnenberg Clinic in Schwilbrunn, We have the ability to measure the sympathetic, parasympathetic nervous system, and it's not just fast, but we can even measure it over 24 hours, over 48 hours. And then I can see how the patient is in their base stress level. Is the person a sympathetic overloaded person? People generally don't notice this themselves. They might feel it a little. They're probably already feeling it on the inside. But there's no symptom for it. But this person who has this sympathetic overload and is parasympathetically weakened, that's a cancer candidate. And if they already have cancer, then, quite classically, this feeds their cancerous tissue. This sympathetic nervous system stimulates the cancer growth in the long run. But also for those who already have cancer. That's why we start there. From this, we get 3 pillars. The detox. When it comes to toxic exposure, we're at the point of carcinogenesis. Then we come to the next sympathetic, parasympathetic nervous system, which is in the gut. We do an intestinal, or in other words, a parasympathetic strengthening therapy. My teacher, one of the early teachers, I thought at the time, it's crazy, Dr. Konrad Wertmann in Salzburg, he said, you know, Thomas, all cancer is a bowel disease. What? What does this have to do with prostate or breast cancer? All cancer has to do with the bowel. Today, I have to say, that's true. The sympathetic, but especially the parasympathetic nervous system is located in the gut. The toxic load that can feed cancer resides in the gut. Whether we have a lot or less insulin, whether we take in sugar or not, has something to do with the gut. And all these fine things can be controlled by specifically treating the intestines. This is not done in the oncological clinics. And so we can determine the metabolic situation, which has a cancer-promoting effect. Hiernes also says that we can significantly change it by also treating the intestines and the intestinal mucosa and the toxic load and also that sugar story stuff. Cancer is a metabolic disease. I wrote that in my big article, my congress as well. Cancer is a metabolic disease. And it's up to the metabolic situation whether the cancer continues to grow or not. And you can't have cancer treatment without metabolic therapy. And I can't believe it, this density of patients. That's just one example. Breast cancer in women is my most common cancer diagnosis that I have to treat. Prostate cancer is the 3rd most common, then come lymphoma, so widespread. This breast cancer patient, she came to me. She was told, we diagnose you with cancer, we have to do this and this and this. You have these and these options with conventional medicine. The surgery date is given already. Exactly. Nobody looks in the mouth. Multiple amalgam fillings, multiple root canals. I then test the cytokines. I can test whether a root canal treatment, a tooth focus in the body, blocks the immune system. You can take the Rantes test, that's modern science. Lechner says hello. Lechner, of course, I know him too. Johann Lechner, he researched it. Chapeau for Johann Lechner, a pioneer of holistic dentistry. He simply proved that positive Rantes leads to cancer. Yeah. Amalgam. Joachim Mutter, another doctor, who's been dealing with this topic for 20, 30 years, has clearly demonstrated that amalgam, so mercury in the body, increases the rate of cancer. Now, this woman comes and has root canal treated teeth. I test Rantes, highly positive, she has amalgam fillings. If you just operate on this woman and then do chemotherapy, then it'll come back. The relapse is inevitable. We have fewer relapses than people who do non-biological medicine. Finally, back to the beginning, where we said a cancer cell can absorb a lot more toxins, so it will be treated with chemo. I just said to myself, if a cancer cell, I'm citing a study in mice where you inject poison into a mouse and it dies. Okay. Now, you take a cancer cell, implant it in another mouse, give the same dose of poison, and you see this mouse doesn't die because of the cancer cell, because it can absorb the poison. Logically, I'd say for myself that I don't have to inject any more poison in here, but actually detoxify the patient. Yeah, of course. But that's such a simple logic, and I'm surprised that this is simply not done in the broad masses, except in biological medicine. Actually, a sad development, but also important for you, dear viewers. There are different ways of approaching problems. With my limited knowledge, I keep looking for the cause and just to try to act on the cause or see that you improve it. And today we hear it from a very experienced professor, Dr. Thomas Rau, that this is simply the right way. The sources of the causes have to go. And then the detoxification, strengthening the environment and giving the patient the chance to heal themselves. And of course, there may be an operation. By the way, what do you think of galvanotherapy to strengthen an encapsulation of a tumour? Yeah, that's a very specific question again. Galvanotherapy is a way of treating the tumour locally. It's just a possibility. And we integrate it. In special cases, it's only possible for nodular tumours. Galvanotherapy doesn't work with lymphoma, for example. And you have to differentiate very well. This is a highly specialised method from physically oriented medicine, which we also do, but actually not very often. What we often do has a similar effect, this intense local hypothermia, where we really heat up the tumour node, targeted, to a temperature of around 44 degrees Celsius. And then this tumour scars. That means it packs itself in scar tissue. I think hypothermia is a blessing. Dr. Bücher-Benner once told me with every degree of increase in temperature, the defences of the immune system double. Exactly. Well, if I really go to 42 or 43 degrees Celsius, that's an incredible power of the body to heal itself again. Of course, it also has to do work with all the viral loads that people are exposed to these days. Yeah, it's very topical today, the viral diseases. I don't want to go into this topic now. But also there we use the heat therapies very successfully. But by the way, hypothermia is a medically recognised form of therapy. There are also oncological clinics that do it. I think it's also used in Bern, for example, or in Aarau. Unfortunately, it's not that common. Thank you very much. That was Professor Dr. Thomas Rau for you, dear viewers. For me, it was just really important to focus a bit again on what I heard recently from this cancer researcher. It's exactly the same language as Dr. Thomas Rau, and I can only appeal here to biological medicine, that you at home, dear viewers, simply Listen to this point of view before you hurry to make hasty decisions. Just a second opinion, a different way of looking at things, where you also include the milieu in your recovery journey. And especially ensure that the research into the causes has taken place, whether you're constantly under stress or there are still foci somewhere that keep triggering and eventually lead to a relapse. We don't want that. I wish you all the best on your way. Thanks for watching. See you next time.